Hello to my Qatar friends, be careful because the poison wind season begins on July 14 in Qatar. The Qatar Calendar House announced on Twitter the start of the small wind season that is common among Arabian Peninsula countries. The Qatar Calendar House explains that will bring very hot, dry winds that stir dust in the air, making it difficult to see in many areas. Residents can expect high weather temperature during this time. According to Arabia Weather, smoke wind was named so due to its harmful effects on plants and humans. The extreme weather condition can cause plants to burn and humans to suffer from sunstroke because of the heat. Qatar Calendar House confirms that will last for 2 weeks and is expected to end on 29th July 2022. What are the precautions to be taken as per doctor advice from Kim's Health Qatar Medical Center?
Good day to everybody. I am Dr. Arthur M. Lantixi. I'm an occupational medicine specialist, but currently I'm working as a general practitioner at Kim's Qatar Medical Center, Barwa City branch. Today we will be talking about heat stress or heat-related illnesses. It is the most common and usually dangerous health condition that we usually encounter at this time of the year, no? Summertime, especially in this place in the Middle East, in which sometimes the temperature will reach 50 degrees Celsius, plus the relative humidity is very high. This is true especially for workers whose work they are exposed to extreme heat in their workplaces. Okay, what are the objectives that we want to learn at the end of this discussion? First, understand the risk factors of heat-related illnesses. Second, recognize symptoms of heat-related illnesses and know how to manage, how to give a first aid management. Thirdly, learn recommendations for limiting heat burden and how to protect ourselves from heat-related illnesses. Okay, there are different kinds of risk factors. First, dehydration is one risk factor. It's a very common one. If you are dehydrated, the temperature regulatory system of the body will be affected. It will hamper the sweating mechanism. At the same time, sweat evaporation is prevented. So, it will prevent the body to regulate the proper body temperature. Okay, another one is the use of alcohol and caffeinated drinks like coffee, tea. No, this kind of drinks can increase your urine output, no? Increase your loss of water from the body. So again, you are prone to dehydration, and again, you are prone to heat-related illnesses. Another risk factors is the clothing. Sometimes thick multi-layer clothing can give problem, especially for workers who are using, this impermeable protective clothing in the work. This kind of clothing can hamper the sweating mechanism of the body. Again, they will be prone to heat-related illnesses. Another one is obesity. If you are obese, if you are overweight, the presence of the subcutaneous fat can hamper also the sweating mechanism or the sweat evaporation. Sweat evaporation or sweating mechanism, this is the usual way for our body to release the excess heat, thereby cooling our body. Okay. Another risk factors is the age. For those who are less than 4 years old, their coping mechanisms for heat is still not fully developed. And for those who are older ones, like more than 65 years old, their coping mechanism is reduced because of some ailments already and some medications that they are taking. Another risk factors is the lack of recent heat exposure. We call this one as acclimatization. We will discuss this one later, more of this one later. This is very important. Another one is the current pre-existing conditions, especially for elderly people, like the presence of hypertension, diabetes, or cholesterol problem, or cardiac problem. Now, for people who have cardiac problem, the main mechanism for releasing heat from the body, if it is too much already, is for our heart to pump more and beat faster. If you have a cardiac problem, it will hinder this proper or this regulatory mechanisms of the body. Again, another risk factors is the certain medications. For people like hypertensive who are taking diuretics, they are taking beta blockers. Even for people who have cardiac problems taking beta blockers. Beta blockers will decrease the heart rate. Again, it will compromise the functions of the heart during heat stress. At the same time, for diuretics, we call this one as a water pills, this kind of medications. It will increase your urine output, and then the patient is prone to dehydration. Again, if you are dehydrated, it will affect, again, the temperature regulatory mechanisms of the body. And you are prone, again, to develop these heat-related illnesses. Okay, the next one is the most important one. The presence of high temperature, air temperature, and the presence of relative humidity. Okay, air temperature plus humidity. This is what we call heat index. Heat index, it measures the body of how hot is the body it really feels, when relative humidity is factored in the actual air temperature. It is the basis for companies to initiate alert procedures when the heat index reaches dangerous levels. So heat index is a combination of air temperature and humidity. And the dangerous levels usually start at around 91 degrees Fahrenheit. 91 degrees Fahrenheit is around 32 degrees air temperature plus 40% humidity. At that level, you will be having like a heat index of 91% or 91 degrees Fahrenheit. So it's a start of a dangerous level already. So this kind of heat index, you can download it or you can find it in the internet now. Okay, so this is usually used by the companies to monitor how hot is the workplaces, so that at least they can manage, and they can manage the timing of the workers. Okay, normally in hot weather, our body cools itself mainly by sweating, as I've said. This is through the process of evaporation. So the evaporation of the sweat regulates our body temperature. Now, we will discuss what are these different kinds of heat-related illnesses, how to identify the signs and symptoms, and how to give the first aid management. This is very important. We'll start with the mildest one, heat rash. Heat rash, also known as prickly heat. In hot, humid environments, when sweat is not readily dried out by evaporation because of a very high humidity, the sweat ducts become plugged, causing the heat rash. So when heat rash is very extensive and then complicated by infections, then it can be very uncomfortable. So how to treat this one? Okay, the worker can prevent this one by resting in a cold place, then keep the rash area dry. You change regularly the sweaty clothes into freeze-dry clothes frequently. And then prevention by always taking a bath and completely drying the skin afterwards, before going to the work and after working. Okay. Another milder one, or another mild form of heat-related illnesses is heat cramps. Heat cramps, crampings of the muscles, usually on the legs area, on the calf muscles. Heat cramps are painful muscular spasms that happen suddenly and usually immediately after exertion. The usual cause is not only water loss, but also electrolyte loss through sweating. So, not only water, but also electrolytes. Electrolytes like sodium, potassium, magnesium. So, usually involves the muscles at the back, as I have said. And then the treatment for this one, of course, you need to remove the victim or the patient from the hot environment and then rest in a cold place. Give cold water. So, drink cold water and electrolytes drinks, no? Or we call it sports drinks. One good example is Gatorade. Gatorade is no caffeine in Gatorade. No? It is non-caffeinated drinks. Although there is some carbohydrates in that one, a little amount, but some Gatorades now, they have this zero sugar. So for people who are diabetic, they can use that one. So Gatorade is very good. The content of electrolytes, especially sodium, is very good. No? So for people who have heat cramps, give cold water. At the same time, if it is available, electrolyte drinks also. You need to stretch also the cramp muscles to relieve the cramping. However, if within 1 hour there's no improvement in the conditions, or if the patients have other comorbidities like a heart problem, then you need to refer it for medical evaluation, for further medical evaluation. Okay. Another one, this is most common. No? This is a mild one, a mild form of heat-related illnesses, but it is usually associated with some injury in the workplace. This is what we call the heat collapse or fainting. Okay, collapse or unconscious. So the body's attempt to control the internal temperature, the blood may pull to the lower extremities. No? And since more blood is going to the lower extremities, less is going to the heart and less is going to the brain also, causing this possible unconsciousness or collapse or fainting. Okay, the onset of heat collapse is rapid and unpredictable and can be dangerous, especially if workers are operating machinery. So this is where the injury came in. At the same time, for workers also who are working on the elevated surface in the workplace, no? So it's very dangerous. So you need to identify this one rapidly and to give immediately first aid management. So how to treat if you notice some workers with collapsing the work site? So move out immediately from the hot environment and then lying down in a cold place. Okay. Use cold compresses also immediately. Prevention, tell the workers to not tell them to move every now and then so that there's not too much pooling of blood into the lower extremities, thereby preventing further fainting. Okay. Now we'll proceed to the more serious one. No? This is what we call heat exhaustion. This is dangerous because uncontrolled heat exhaustion can evolve into heat stroke. No? Heat stroke is the most dangerous, life-threatening conditions. Fortunately, this condition, heat exhaustion, responds readily to prompt treatment. So, usually heat exhaustion is characterized by heavy perspiration, too much sweating. But when you take the temperature of the patient, usually it is normal or slightly above normal only. So you need to take note on this one. No? The temperature of patient with heat exhaustion is usually normal or slightly elevated only. But there's too much perspiration. This one is very important because this will differentiate, these symptoms will differentiate it from heat stroke. Okay. Usually, heat exhaustion is caused by water and salt depletion or electrolyte depletion. Okay, so the symptoms of heat exhaustion: severe thirst, fatigue, headache, nausea and vomiting, sometimes diarrhea also is present. So how to treat this one? Again, move the victim immediately out of the heat to a cold place. Give cold liquids, not cold, but cold liquids. Okay, and then again, electrolyte replacement fluids. Raise the victim's legs maybe around 8 to 12 feet, or around, not feet, 8 to 12 inches above the ground, just to increase the blood flow going to the heart and to the brain also. Remove the excess clothing immediately, then sponge the victim's body with cold water and sit in an air-conditioned, if it is available, air-conditioned area or next to a misting fan. Not the regular fan, but a misting fan. Okay. If there's no improvement of the condition after 30 minutes, then you need to call ambulance for further evaluation and management in the hospital. Okay? Because as we have said, if we cannot manage properly or immediately the heat exhaustion, it will evolve into heat stroke, the life-threatening conditions.